is Min Lian. I'm a professor from National H&D University. And we have two excellent researchers going to present their work here. Unfortunately, we only have 1 hour in this section. So each one of them is going to have the 25 minutes for the presentation and 5 minutes for the question. And so I don't want to use too much of time. Both of them have published very good papers in top journals. So let's welcome Professor Peter Lundborg first.
Is it on?
Yes.
Yeah. Okay, so thanks a lot for the invitation. It's great to be here. And this is going to be a paper on school lunches. I'm going to show you some pictures of food. So we're going to study the long-run effects of free school lunches, and we're going to look at the case of Sweden. And this is joint work with my co-authors Donald Fruit at Stockholm University and Jesper Alex Pettersson in Lund. So I think I'm going to, in this introduction, I think I'm going to go back a little bit also to what Douglas was talking about earlier on here to motivate this paper. And I think, I also think that there is, as you all know, this very large literature on early life insults. A lot of it coming from pretty extreme events like earthquakes, dust clouds, Ramadan fasting, and milder shocks like that. And there's also perhaps growing evidence on the role of policies targeted towards kids, right? But often also very early in life. And I think also it's true that we know less on the long-run benefits of policies targeted towards kids early in life, but perhaps in a little bit later stages of childhood, okay, beyond the first years of life. And I would say that we know close to nothing about the long-run benefits of something which is potentially very important, right? How we serve our kids, or what we serve our kids in school. Because, surprisingly, right? Because it shouldn't matter somehow, given that kids spend perhaps 9 years in primary school, but there's not so much thought in, what we're actually serving the kids in school, although there's been various initiatives to improve standards, right? But we know, I would say, surprisingly little in developed countries about, what's the effect of what we're serving the kids in school. So this is where our paper comes in here, I think. So it's interesting to, just Google around and read about school lunches in different countries. And this is not representative, perhaps, in all cases, I'm going to show you, but it's not so far from the truth sometimes, So a lot of these pictures come from actual school lunches. And I just want to show this to illustrate the enormous heterogeneity that exists in school lunches. And so it's so surprising to me that this is, what you serve kids in school during 9 years, 5 days a week. That, sometimes you get this kind of stuff, And rightly, there is a lot of worries and concerns about, these school lunches, especially in the US, but also in the UK, and also in Sweden and other countries, about what is the impact of these lunches sometimes also that's being served, right? Could it be that they even contribute to the kind of obesity epidemic even, right? So I'm going to talk about some evidence on that just in a minute. So, and this was perhaps the worst school lunch I saw. So this is a Dutch school, school lunch, and I've been living also in Holland. I can confirm that even some of my colleagues were eating this stuff during lunch. So there's some persistence also, from childhood to adulthood. Of course, the French then, of course, this is an actual menu from Paris. So a lot of the things you see, is what you would expect. This is a 3- and 4-course menus typically that they would have. So it's a lot of variation, basically. And Taiwan, it seemed pretty good. I mean, this stuff I would eat for sure, right? I think you're doing well in this comparison here, for sure. So basically, the motivation is that we know almost nothing about, what we serve to our kids in school. There's some evidence, I will talk about it. But there's also a lot of concerns about the nutritional standards of school meals in many countries. And in the US, as I said, the school meals has even been blamed in some papers for the obesity epidemic. There's been various initiatives in the US, 2010, 1994. You have seen these initiatives to improve nutrition, but it doesn't seem that these are followed all the time, basically, right? You have seen in the UK, perhaps you have seen Jamie Oliver, perhaps, in the documentary where he goes to UK schools and tries to improve food. The kids hated the food in the beginning, but it seemed to have worked out in the end. So now they have improved standards a bit in the UK. And it's also interestingly, more recent events, it seems also that, both Donald Trump and also Theresa May in the UK, they try to scale back some of these programs. So Donald Trump, we have seen that he wishes to deregulate some of the nutritional requirements for the school lunches that are provided. And Theresa May wants to cut funding for some of the programs in the UK as well. So you know, it would be good to know a little bit more about the effects of these school lunches. So what we're going to do in this paper is to study the long-run economic benefit of a program that, you know, was given free universally for all kids in Swedish primary schools, and it was highly regulated in terms of nutrition. So we're going to ask, you know, what is the long-run economic benefits of that? We focus on income. We're going to look at some of the what's called like the middle period here. So what was the impact on schooling, cognitive skills? Do these kids actually grow taller because of this, you know, improved nutrition? And we're going to ask, was the mechanism mainly through nutrition or being more energetic in school? Or was it also because of the fact that you get free school lunches? So it involves household savings, of course. And it also means that we need to address if the effects we see, do they arise because kids actually go to school because now there's food served, which was not happening before, right? So the counterfactual here you have to think of is a situation where nothing is served in school, okay? So normally kids went home during the lunch, mom was cooking, or they brought a lunch pack, and that is the counterfactual. And I'm going to talk more about the reasons why this program was implemented. And we're going to focus on the 1950s and 60s, and then follow up in the long run. So just, you know, briefly about the findings. We find that those that were exposed to this program for the entire 9 years of primary school, they gained a lot in terms of income in the long run, right? So average income during life increased by about 3%. You see that it increased years of schooling by a third of a year. We also see some effects on the height of males and females as measured through military enlistment registers and also through medical birth records where we measure the height of women. And we can also probably rule out that it worked through attendance in schools or through savings in household income. That doesn't seem to be driving the effects. So I think this is one of the first papers that showed the long-run economic benefits of these school lunches. So I think there's several literatures that we relate to here. The first one was Douglas was talking about before. So you have this literature on policies that affects kids in developed countries. So you have seen food stamps, for instance, Head Start, earned income tax credits, welfare benefits, etc., etc. But there are more papers as well. So that's for sure we relate to that. Of course, we relate to the literature on school meals. But if you look at this literature, it's mostly US-based, looking at the school breakfast programs, the national school lunch programs. You see that there's a lot of, it's pretty mixed evidence actually in the results. Sometimes you see increases in overweight, obesity from exposure to these programs, sometimes not. Sometimes you see some effect on academic outcomes, sometimes not. And it's mostly short term. There's only one paper that looks in the little bit more longer term, and this is the Hinrich paper, which looks at education in the longer run, finds effects and explains those effects or argues that these effects are completely driven by attendance, that people show up in schools. Therefore, you see these effects. There's a paper in Norway, a working paper, doing something similar. They focus on a different policy, though. So it differs from our paper in the sense that they look at the policy that shifted the timing of the school meals from the end of the school day to the beginning of the school day. So it's breakfasts in Norwegian school in the 20s and 30s in the countryside of Norway. So it differs in that sense. And of course, it also relates to the literature on nutrition, which is mostly in development countries. So I'm going to talk a bit about the school meal programs. What was it and why was it? So basically it started in 1946 where the government was providing grants to municipalities that wanted to introduce school lunches. And these grants were covering basically everything that was needed. This was the kitchens, the staff, the ingredients to cook the food. They were providing courses for the staff. And they also provided menus. I'm going to show you some menus that were highly regulated in terms of the nutrition that they had to comply with. So the conditions were that they had to serve these nutritious meals, so that was followed up, and they had to be free and universally provided for everyone, right? So no means testing. So the nutrition was the most important goal. So there was large concerns about the nutritional standards for the kids during this time period, but there was also additional goals of easing the economic burden on the households of having to serve these meals. And also there was a less important but also an interesting goal of releasing women from the household and not having to cook and perhaps entering the labor market instead. So the motivation largely came from the fact that there was a lot of research going into the quality of the food that the kids brought to school or the food that mom was cooking at the home basically. And they were basically saying that this was of very low quality and the nutritional quality was very low. And especially it showed that there was a lack of vitamins, A and D, and proteins, right? So for these reasons, and this came from investigations into the lunch packs of the kids, but also from household surveys where they tried to get an idea about the quality of the food that they consumed at home, right? And mom's cooking was not so great, actually. So the new guidelines that were then set for these menus, you know, it was about the quality. It should cover 1/3 to 1/2 of the daily doses of nutrition, full dose of A and C vitamins. And then you see this very regulated kind of guidelines on proteins, iron, vitamin B, vitamin C, etc., down to the grams here. Also, the meal should be tasty, so the kids had to like to eat this food, right? Otherwise, it would be kind of a waste. And this is, none of you are going to understand this. It's Swedish, but I just want to give you an idea about the kind of, you know, the guidelines that were put out here. So these are menus provided by the National Board of Welfare and Health in Sweden. So they basically were following these kind of rolling 6 or 3 or 4 week menus. And this is kind of, I don't know what Jamie would call it, like hearty, or, you know, like really home cooking. So it's a lot of stews, sausages, liver beef, potato, a lot of potato, of course, fish, vegetables, fruit. It looks pretty good, actually. I mean, I would eat this stuff. It's like a typical Swedish food, prepared and cooked in the schools, right, by chefs that were trained in cooking. So they basically had to follow these menus to be able to get these grants. And the idea was that these menus would also give you this kind of ingredients, right, when it comes to nutrition, because otherwise it's difficult for the staff to do it themselves, of course. So the school meal program, so it was basically an offer to the municipalities. So it meant there was no experiment like that, right? But it was introduced gradually over something like 1,000 municipalities. And we're going to exploit that gradual implementation in a standard kind of differences design. It only covered primary schools. So that's grades 1 to 9, and you enter school when you're 7. And we went to the National Archives in Stockholm to get the date of introduction of these school meals across different municipalities, basically by looking at the receipts that we're sending into the government to get the money. We're going to focus on the later phase of this program, simply because of the fact that the earlier phase is not to be found. The dates of those introductions was not to be found in the National Archives. We're going to focus on the 281 municipalities that had not yet introduced a program in 1959. So we're going to use 59 to 69 here. So this is just showing you the gradual implementation here. So you have about 25 new municipalities each year from 1959 and onwards. And of course, what you want to see here in our design is that, so we're going to exploit basically that some introduce the school programs at some date, right? And some will do it later on, and these will be the controls. So we want to see that the early, the middle, and the late adopters of this program have kind of common trends, at least in pre-outcomes here. So we can divide it into these groups and also include the group that already introduced the school lunches by this time. And you see something like this. Now, I realize it's very hard to distinguish the lines here, but that's also partly the point here, right? So they actually look very similar, both in absolute terms and also in terms of trends. So this is looking at the male adult income for the cohorts born, you know, before and after the introduction of the school lunches, and the red line is the first year when our cohorts, the first cohort that were exposed to the school meal programs. And you see from the male income, look at these cohorts, and for female income, also for years of schooling, they look surprisingly similar. So it doesn't seem to be a very strong selection in terms of observable characteristics in the timing when this was implemented, really. And it also looks like the trends were pretty okay, and I will show you some more on this later on. So the data we have here is based on register data. So we basically start with the data on the entire population of Sweden, and we focus on the people born 1942 to 1965. We also have data on their parents, and we get income from the tax records. We have schooling from the education registers. We have parents, and we have location data from the censuses, which is used to place these kids right in what municipality they were belonging, what schools. We're going to use military enlistment data to get the medium run outcomes, such as IQ, height, etc. We're also going to use the medical birth register to get stuff like the height of the women that we see here, at least the ones who were having kids in our data. And we can exploit also the fact that there's so the high compliance with this program. So because of the fact that the municipalities had to keep track of the number of students that took these meals every day, there is data on the daily basis how many was taking these meals. And it seemed like above 95% actually entered the school restaurant every day on average, right? We can't know if they were eating the food, of course, but they actually went there. So it's a good chance that we're eating as well. So it's a standard setup then. We're going to use a model here where we have municipality indicators, cohort fit effects, and we're going to have some control variables being standard stuff like male, female, and we're also going to control for the compulsory schooling reform, which partly went on during the same time period. So we need to control for that to not confound these estimates. And then we're going to specify the exposure here in two ways, right? Because it was introduced at one point in time in a municipality, so it meant that you could have cohorts that were just partly exposed and fully exposed. So some were exposed for the entire primary school period. Some might have been in 5th grade, so they were only exposed for a few years. So we're going to specify this as both just a linear years of exposure variable and also a dummies for each year of exposure. So we can do some nice graphs with that. So these are the first results I want to show you. So we're going to show first the long-run effects. Then I'm going to go into the mechanism a bit and see what's going on here. And then I'm going to rule out some of the alternative mechanisms that might be relevant here as well. So in the first column, we have the standard diff in diff estimate. And in panel A, you see the effect of one additional year of exposure to school meals. Okay? And you see that there's a positive coefficient. So it would add 0.3% of earnings. But then you see in panel B, where you do this by dummies, right? That it seems to be driven mostly by the ones who were heavily exposed to these school meals. So basically, is there a pointer here? Yeah. You see that the effects start to occur for those who were exposed to the meals for 6 years or more, right? Which is also consistent with the idea that earlier exposure to these programs are more important, right? Although we cannot, of course, separate the effect of the length of exposure from age at which you had the school meals at first, right? That's not possible. But it's very consistent with the idea that it matters more if you get this early on. Then we do some standard stuff. So we add municipality linear trends here. We add here quadratic municipality-specific trends. It doesn't matter. You get the same results, basically. So basically, you see that those exposed for this school meal program during the entire primary school period, it increases their average earnings during the lifetime by 3% almost, which is more or less the same as the return to 1 year of schooling in Sweden. Here we see the income results for the military enlistment cohorts that I'm going to show you next. So this is the data for males who went to the military enlistment, which is most males. We just want to ensure that you also see the income effect for those. And we do. It's very similar here. So next is showing you some graphical evidence. So this is the income effects. These are the dummies here, plotted like this. And you see just what you saw in the table, that, yeah, indeed, it seems to kick in here for those having 5, 6 or more years of exposure here. I'm going to return to the schooling results in a minute. We also do a kind of event study thing here. This is, again, to check for the parallel trend assumption. So here we just, look, for simplicity, we just focus on the ones who were exposed to the entire schooling period with the ones who were never exposed. So these are kind of cohorts pretty far apart, but, it makes for a nice event study graph. So this is basically dummies for each cohort that were not exposed before, right, up to -4, and for cohorts that were exposed after here. And it's exactly what you want to see. So you have a jump for the first cohort that was exposed, but there is no pre-effects here that will reveal something about pre-trends or so. Heterogeneity. So was it the case that some groups gain more? So here we do a very simple thing. We just split these groups, exploiting the parental data we have. So we divide it into income quartiles. And this is based on the household income of the parents, right? So we just split it into quartiles. What you see here is actually that, yes, the lowest income quartile, those kids from the household with the lowest income quartile, they seem to gain the most, although we cannot reject that these coefficients are the same in the 3rd and 4th income quartiles. The second one, we're not sure why this is like this. It's something we have to look into more. No big differences between men and women here in the effects. So starting to look into what's going on here. So why do you see these long-run effects? So one explanation would be that they obtain more schooling, right? Because of this, they're more energetic in school. They are better, better nutrition, better food. Also makes for better study results, perhaps, which some papers suggest in the short run. This is indeed the case. So we see here effects on schooling. This is years of schooling here. This is, if you go to high school or not. this is if you go to college or not, right? And in all these dimensions, you see some effects. Largest effect is for years of schooling. So this adds, if you look at the ones who were exposed for 9 years, it adds 0.3 years of schooling from a baseline of 12.2, I think. But you also see effect on college attendance here. This is increasing the likelihood by 1.5 percentage points out of a baseline of 0.36. So it's small but not trivial effects. And I think also if you think about how much could this increase in schooling that we see here, years of schooling, explain of our income effects? Well, if we look into the kind of returns to schooling aspects for Sweden, we could perhaps say that these years of schooling effects could in principle account for 70% of the income effects we see here. So it could be an important mechanism here. So we're going to look at then the height, the BMI, overweight, obesity, cognitive skills. So first of all, height might be very important here because one important ingredient here in the school lunches were protein, right? Which is an important determinant of height as well. And indeed, you see here that this is years of exposure. So adding 1 more year of school lunches increases your height. So if you take that to 9 years of exposure, we see basically that these who were exposed for 9 years compared to non-exposed, they grow something like 0.6 centimeters. It doesn't sound too impressive, but it actually means, that's like 10 years of secular height growth in Sweden. So it's not a trivial estimate. We actually find similar effects for females when we look into the medical birth register, where they record the height of the women, when they enter the maternity clinics. So, if we believe the previous returns to height estimates that exist in Sweden and other countries, perhaps you can attribute a quarter of the income effect to this kind of height gains. And this is showing you the results. For height, we also see this kind of patterns where earlier exposure matters most, right? So again, it's indeed the case that you need 5 or 6 years of exposure or so for this to kick in. For cognitive skills, we see nothing, which is a bit surprising to us, right? But it might be that age 7 and onwards might be too late to affect these kind of cognitive skills in a major way. So we still need to think about why we don't see anything here. Overweight BMI, of course, important here because of the results from US studies showing that there is some tendency to gain weight from these school meals. We don't see anything in Sweden here. So basically, we only find effects on height here, nothing on BMI, overweight, cognitive skills. So the question is then, okay, so we see these effects, but is it mainly through, kids being more energetic or perhaps smarter in school? Or is it because of the fact that the free lunches means that the household would save some money, of course, right? They no longer have to provide this, so there will be some savings. And in addition, could it be that this actually makes students attend schools in Sweden, right? Because of these school meals? Because that would be a very different mechanism. So starting with the first thing here, the potential savings, but also, so the potential savings that the household could make. So the argument we're going to make here is the following. So if there is an income effect at the household level because of this, save money because of these lunches, it is something that should gain all the siblings in the family, right? So then the whole family should gain from it because it's a household saving thing. So what we can do here is to add also family fixed effects in addition to our standard design, right? And if you expect that, there's a household savings effect that gives rise to this long-term effect, well, maybe you would see that the effect vanishes within household then, right? So what we did here was to basically add family fixed effects. But if anything, we see that the point estimate grows a little bit stronger even within families. And here we even restricted it to siblings born quite closely apart. Because it will always be the case, of course, that the younger sibling, the youngest one, will always be exposed to these household savings for a little bit longer time. So it's important that we do this on closest spaced siblings. We also find effects for schooling within the household, a little bit smaller in magnitude, but also for height, these effects remain within the household. So we think that any household savings that might exist or any effect on female labor participation and the income coming from that should gain everyone in the household, but then we shouldn't perhaps see these effects that we do here. So we don't think that the savings is so important. And we also calculated the potential savings that you could make as a household from these school lunches. So if you take the cost of the schools of providing the meals as a kind of proxy for the cost that the household would have as well for making the food, which is clearly an overestimate if you look at the food that they were having at home, right? But if you take that, you would see that the savings that could make are way too small to be able to explain these big effects we see if you look at some of the earlier papers from the US, for instance. Okay. So I see the time's up, so I'm just going to go to the conclusions. So we think, that this is might be a promising way of improving child outcomes in the long run. We see that lifetime increases are big. It seems to go a lot through education, but we also see some, evidence consistent with nutrition improvements coming from the increased height of these both males and females. But we don't see any effect on caloric intake, overweight, and fixed skills like IQ that perhaps are fixed at these ages do not increase so much. So that's it. Thanks.
Probably only have time for maybe one or two questions. Go ahead. Yeah. Could you just use a microphone instead of microphone?
So, in the development literature, at least, a lot of attention gets paid to the possible substitution of food back home towards other children or towards other people in the household. Now, you had one family fixed effects, but can you look at siblings, and is there an externality effect on other siblings? Because perhaps a little bit less is fed to the student at home and more to their siblings, for example.
Yeah, for sure this is something we want to do. I mean,
It's a well-known paper by Hanan Jacoby, you may know it, in an economic journal in the early 2000s that looked at this in the Philippines, found that there was some of this going on, especially in really low-income households, but there was not complete substitution.
Right. No, so indeed. So we have some things on the do list we want to do, and that involves externalities. One is externality on siblings. We can do that because we observe all of them, so we're going to do that. But we're also going to look at externalities in the form of the next generation. So we're now adding data on the kids of these kids that were exposed to the school meals. And we have seen already that we don't see any effects on the birth weight or APGAR scores of the kids of these kids, but we want to look at educational outcomes of the kids, that we think there might be more bite. And it might be that you said, Douglas, that everything doesn't show up in birth weight in these measures. So we want to look at educational outcomes for this second generation. So indeed, we want to do this kind of stuff. Yeah.
Yes, I think one important aspect of what you do, it's about inequality, no? You do not stress it much in the conclusion, but when you do the regression by quartile, no? It's all about poor people, no? Probably the higher quartile, it's compensated. Bad food at school or at lunch is compensated at home later on. So I don't know, maybe you can do, by how much would the Gini coefficient be reduced by your intervention? I think you can even do a kind of simulation.
No, you're right. So the reason I'm not stressing that at the moment is that we indeed see these greater point estimates for the lowest quartile of the parental income distribution. It's just that, the point estimates are not that different that we can, really say that there are very different results across the groups. There is a tendency, but we can't reject that these point estimates are the same. So we're not at the moment stressing that so much. We're talking more a bit like a tendency in the data. So that's why.